It is my pleasure to introduce you to Dr. E.J. Shiuey, our specialist in cataract surgery, laser vision correction, and corneal diseases. Dr. Shiuey graduated with the highest academic honors from Columbia University. He then attended the University of California, San Francisco for both medical school and internship. Afterwards, he completed his residency at the Harvard Medical School Department of Ophthalmology, where he served as an instructor in cataract surgery and its associate chief of ophthalmology. Dr. Shiuey was also awarded the prestigious Heed Fellowship, which is only given to approximately 20 ophthalmologists per year to receive advanced training in cornea and refractive surgery, the art and science of reducing the need for corrective lenses. Dr. Shiuey scored in the top 1% of ophthalmologists on his board certification examination. He has been a physician at the Palo Alto Medical Foundation since 2001 and has performed over 10,000 eye surgeries. Before you meet Dr. Shiuey, we will be showing you a brief video which explains cataract surgery and the available lens options. Thank you again for coming to our office and for choosing the Palo Alto Medical Foundation for your care.
The way you use your vision shapes how you live your life. That's why cataract surgery is more than just a common, simple procedure. It's a chance to rediscover what makes your life remarkable. The Acrosoft IQ Vivity lens helps you see clearly at crucial far and intermediate distances while still providing functional near vision. It is a cataract replacement lens that gives you the focus you need where you need it most. Cataracts form in the natural lens of your eye and block light from passing through, which prevents you from seeing clearly. During cataract surgery, a surgeon removes your clouded lens through a tiny incision and replaces it with a new clear lens. This is one of the safest, most common, and most effective procedures performed today. If you have cataracts, everything you see is likely hazy and dull. After cataract surgery, things will look clearer and brighter. However, your basic cataract replacement option, the monofocal lens, only clears your vision at a distance. You'll likely still need glasses for the moments when you need to see things up close. The Vivity lens delivers sharp, clear vision far away and at arm's length. The Vivity lens also helps you take advantage of vision up close, which means that while some patients may still need glasses for close distances, many are able to leave glasses behind. The Vivity lens renews your lifestyle and helps you feel comfortable and confident with your own vision. You can see clearly and enjoy more of the things you love, like driving a car, cooking your favorite meal, or playing a game. You can see simply by experiencing low instances of halo and glare. You can see satisfied. Join the many other patients who have found success with the Vivity lens. Embrace what's important in your everyday. Do more with revitalized vision.
Hello, I'm Dr. E.J. Shiuey, and thank you so much for choosing me to be your physician and for choosing the Palo Alto Medical Foundation for your care. If you've been told you have cataracts, you're not alone. Cataracts are a very common condition that affects the clarity of one of the natural lenses in your eye, often leading to blurry vision, glare, and difficulty with tasks like driving at night and reading in dim light. The good news is that cataract surgery today is a highly successful outpatient procedure that can significantly improve your vision and your quality of life. During cataract surgery, we gently remove the cloudy lens with a technique called phacoemulsification and replace it with a clear artificial lens called an intraocular lens, or IOL. The surgery itself typically takes about 15 to 20 minutes, and your total time at the surgery center will be about 2 hours. Most patients are pleasantly surprised by how quick and comfortable the experience is. Recovery is usually smooth, with many people returning to light activities within a day or two and returning to work within a week. The full recovery for cataract surgery is 5 weeks, and at that time, it is expected that your vision will be stable enough for you to obtain a new pair of glasses. As with any surgical procedure, there are risks involved. These can include infection, inflammation, elevated eye pressure, swelling, retinal detachment, or the need for additional surgery. Fortunately, serious complications are unusual. The risk of infection is about 1 in 1,500 cases. If you follow your instructions on using antibiotics, you will be lowering this risk as much as possible. The need to do another surgery is generally less than 1%, and the vast majority of people, about 98.5%, do very well. It's important to understand that while we do our best to prepare you for surgery, It is not possible to list every potential complication or outcome in this video. You will also have the opportunity to read a consent form document that further details possible risks. That said, we're always happy to answer your questions and make sure you feel fully informed before proceeding. Now let's talk about lens choices. One option is a monofocal lens, often referred to as the standard lens. This type of lens is covered by insurance. In the absence of astigmatism, this lens usually provides good vision for far. With a monofocal lens, you'll likely still need glasses for anything arm's length or closer. It is important to understand that the monofocal lens does not correct for astigmatism. If you have significant astigmatism in your eyes, you would be expected to wear glasses for both far and near activities. Another option is an advanced lens known as the Vivity lens, which is known as an extended depth of focus lens. The Vivity lens is designed to stretch and enhance your range of vision, offering greater clarity not only at distance, but also at intermediate ranges. Intermediate vision is the vision that you use most of the day. It is the vision that you use when you are talking to someone sitting across from you or when you are cooking or eating. It is also the vision you use when you look at a computer screen, laptop, dashboard, GPS, or your phone at arm's length. Importantly, Vivity surgery will include the correction of astigmatism when necessary, which will improve your vision at all distances. One of the benefits of the Vivity lens is that it uses a unique technology that extends your focus without splitting light, which can reduce the risk of glare and halos at night, something that happens more commonly with an older technology called a multifocal lens. It's a great option for people who want more freedom from glasses and want to be able to drive, watch TV, and read average size print without glasses. However, the Vivity lens does have some limitations. While it enhances intermediate vision, it may not provide full reading vision without glasses, especially for fine print, such as when trying to read the label on a pill bottle. For fine print, you should expect to wear a low power, over-the-counter reading glass of about plus 1.5 diopter power. And although the Vivity lens reduces glare and halos compared to multifocal lenses, these symptoms can still occasionally occur. However, studies have shown that the quality of night vision for someone who has Vivity lenses implanted in their eyes is not measurably different to that of patients who have chosen monofocal lenses. It is important to note that the Vivity lens is considered to be a cosmetic lens by the insurance companies because of its ability to reduce your need for glasses. Both the cost of the lens as well as the surgical planning for the lens is not covered by medical insurance. The out-of-pocket portion for each lens is approximately $3,500 for each eye, and many of our patients choose to use a no-interest payment plan for their convenience. The choice of which lens to use is completely up to you, but I will be happy to answer your questions so that you can select the best lens for your needs and lifestyle. If you choose to have surgery, you will need to prepare your eyes for measurements by using an over-the-counter preservative-free artificial tear called Refresh Optive. You should use this artificial tear at least 4 times a day before your activities, such as reading, driving, and computer use. You should also use a hot-wet compress twice a day for 10 minutes each time. Ideally, you would do this for 1 to 2 weeks before your measurement appointment. You will also need to obtain a medical clearance from your primary care doctor. Please message your primary care doctor and let them know that you will be having cataract surgery and need a medical clearance. If you have had a recent medical exam by your primary care doctor, they will usually not need to see you in person. My assistant will be reaching out to you to help you schedule your surgery in about 1 week. She will go over the details of your surgery, including the location, dates, and times of your appointments, and will be able to answer any of the common questions you may have. Thank you for considering cataract surgery with me. I'm honored to be able to help you rehabilitate your vision as well as to improve your quality of life.